billahi minasyaitanir rajim. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. And good morning to everybody, especially our friends from the media. My report to the Bangsamoro is dated as of 13 March 2020. Alam naman natin na mabilis nag-iiba yung mga figure natin with regards to the statistics on COVID-19. The novel coronavirus, which is now named COVID-19, has affected hundreds of thousands of individuals around the globe and has claimed the life of many. This prompted the World Health Organization to declare it as a global pandemic. However, in spite of the seriousness of the disease, it must be underscored that majority of patients recovered from it. Those who succumbed are the ones who are immunocompromised and those who have comorbidities such as patients with heart disease, renal disease, hypertension, diabetes, etc. Today, there are already confirmed cases of about more than 110,000 with 3,817 deaths globally and still counting. In the Philippines, there are already 52 confirmed cases with the addition of 3 more yesterday. There are 3 deaths with the recent death of 2 more patients as of yesterday, and more than 44 cases under investigation. Due to the disturbing rise in the number of positive cases that is made more alarming by several cases of local transmission, the Secretary of Health, Dr. Francisco T. Duque III, raised the alert level to Code Red Sub-Level 1 on 8 March 2020, and subsequently the President released on 9 March 2020 Proclamation number 922 declaring a public health emergency throughout the Philippines. As of yesterday afternoon, 12 March 2020, the President, during a press conference, announced a resolution submitted to him by the Interagency Task Force on COVID-19 that recommended, among others, barangay, municipal, city, or provincial quarantine for those with positive cases, suspension of classes, and the suspension of land, air, and sea travel to and from Metro Manila from 15 March 2020 to 14 April 2020, purposely to fight and control the spread of the killer virus. In Mindanao, there is 1 confirmed case with positive laboratory result confined currently at the Northern Mindanao Medical Center in Cagayan de Oro City. Investigation of the case is now being done and contact tracing is now in progress. We are now partnering with the DOH Region 10 in implementing the investigation and contact tracing activities. In MOHBARMM, there are 2 persons under investigation and 5 persons under monitoring. But during the conduct of the Tabang program of the Chief Minister on 9 March 2020 in Hulu, where the MOHs provided medical, surgical, and dental services to the recent victims of conflagration in 3 barangays in Hulu, the Provincial Health Officer 2 of Sulu reported that their province is COVID-free. Immediately after the humanitarian event, the Regional and Epidemiological Services Unit of MOHBARMM, headed by Dr. ADLSNTV, was dispatched to the provinces of Tawi-Tawi and Basilan to confer with the provincial governors and at the same time get an update on their latest COVID-19 status. So far, there is no indication on the presence of COVID-19 in the island provinces. Hence, as of 11 March 2020, BARMM is still COVID-19 free. What is the MOHBARMM doing? Number one, as early as the declaration of Code White Alert status on January 30, 2020, the Ministry of Health called a consultative meeting of provincial health officers, city health officers, chiefs of hospitals under MOHBARMM, including representatives of DOH-retained hospitals operating in BARMM, such as the Cotabato Regional Medical Center in Cotabato City and Amaypakpak Medical Center in Marawi City, to discuss how to mount an appropriate response. Number two, one of the most important results of the meeting is identification and equipping of referral hospitals across BARMM that will have dedicated wards for the proper isolation and treatment of COVID-19 cases. These hospitals are the following: Maguindanao Provincial Hospital in Sharif Aguac, Maguindanao; Cotabato Regional Medical Center in Cotabato City; Amaypakpak Medical Center in Marawi City and Lanao del Sur; Sulu Provincial Hospital in Hulu Sulu; Datos Halon Sakilan Hospital in Bungao, Tawi-Tawi; and Lamitan District Hospital and Basilan Provincial Hospital in Lamitan City and Basilan Province. As soon as the DOH declaration on Code Red Alert status came out, the Ministry of Health, BARMM, issued an advisory on the same day directing all MOH facilities such as IPHOs, CHOs, hospitals including DOH-retained and private hospitals operating within BARMM to heed the call of the DOH Central Office to focus all efforts in responding to the emergency and ensure the protection and safety of all BARMM constituents. Along with the issuance of the latest MOHBARMM advisory on COVID-19, the Minister of Health recommended to the BARMM Chief Minister, Alhaj Murad Ibrahim, to issue an advisory or memorandum to all ministries, offices and agencies and other instrumentalities of governments, including the local government units and the PNP BARMM, to comply with the Presidential Declaration to mobilize government resources, ease processes, and intensify the reporting of COVID-19. As a result, the Chief Minister issued a directive for the creation of the BARMM Interagency Task Force COVID-19, which will be chaired by the Office of the Executive Secretary, including all BARMM ministries and other relevant offices, which will formulate policies for the coordinated emergency response and formulate action plans to protect the constituents of BARMM from the threat of COVID-19. This afternoon will be the first meeting of the Interagency Task Force. Number 6, intensification and strengthening of the already ongoing activities of the Regional and Epidemiological Surveillance Unit of the Ministry of Health to include active surveillance in the seaports and airports, provision of additional personnel, and immediate appropriation of fund support pertinent to the program. Proposed for the provision of funding and logistical support to health facilities, especially hospitals, where there are dedicated wards that can attend to COVID-19 cases, whether under monitoring, investigation, or supportive treatment for confirmed cases. Number 8, intensify ongoing advocacy and public awareness campaign in tri-media and social media and the reproduction of IEC materials and their placement in conspicuous areas that are readily visible to the public. And number 9, to intensify focus on personal level hygiene and prevention, as this is the most effective means to protect ourselves from the disease. These are the following. Letter A, frequent hand washing with soap and water. In the absence of soap and water, use alcohol in the absence of soap and water. Letter B, proper cough etiquette by covering your mouth when coughing to prevent the spread of the virus and contaminating other persons near you. Now, letter C, avoid massive crowd. Letter D, social distancing such as refraining from hugging, kissing, or even handshakes. Letter E, refrain from international travels or even visit to areas where there are greater number of positive cases. Letter F, frequent drinking of water to keep the throat moist. Letter G, wearing of appropriate masks for those who are suffering from cough and those who are exposed to sick patient suffering from cough. We are not recommending this to the public in general. Self-imposed quarantine for those who have history of travel abroad, especially if these people become sick. Number 10, we emphasize on protection because there is no cure for the disease. A vaccine for COVID-19 is not yet available. Positive cases are merely being given symptomatic and supportive treatment. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.